Great, thank you. And hi, everyone, and welcome. We're presenting today on peer recovery support specialists, partners in research and practice. We'll be talking about a project that Ivy, Morgan, and I have been working on over the past several years called ROAR, which stands for Reducing Overdose After Release from Incarceration. So I'm just going to quickly go through kind of what we'll talk about today. We'll spend a little time going through introductions of ourselves so you can see where we're coming from this work. And then we'll give an overview of what the ROAR project is and also share some really preliminary findings, some early data that we have on how the project is going, specifically related to the implementation of peer services in the project. So it's really early information that we'll be sharing. So excited to hear from folks about what you think about it. So yeah, please utilize the chat and we'll have times throughout to break and you can ask questions and share your insights and everything. And then I'll pass things over to Ivy and Morgan to share their experience providing peer services as part of this project, ways that it's different than the regular work that they do at CODA and Bridgeway, ways that it's the same, and also how COVID has kind of impacted the work. Again, there'll be more opportunities for people to share their experience as well and thoughts around this project and this work. So excited to hear from you all. All right, Ivy, I'll pass it to you.
I'm Ivy Myers. I'm a recovery mentor supervisor at CODA in Hillsborough. These are a couple pictures of me and my two daughters, and the one at the bottom is when I got my CRM certificate in 2016, and just kind of some pictures of me trying to live a healthy lifestyle.
Hi, I'm Morgan Nelson from Bridgeway. These are pictures of me and my family and kids and me doing the Hooded Coast race because that's been a huge part of my recovery is running. So those are like important things to me. Thanks.
Thanks, Morgan and Ivy. And my name is Erin. I work for CoMagine Health, and we've been partnering with CODA and Bridgeway to do research for this project. I am a family member and an advocate of someone who has a severe and persistent mental illness. I come to this work with that perspective, and also some things about me is that I also love running, and that's a picture of me and Morgan from Hood to Coast. She has motivated me to be a part of those relays, which is really exciting. And then during the pandemic, I've gotten into pickleball. So that's that picture in the middle with some friends that we could safely see each other and engage in fun activities. And then that's me with my dog on the beach. That's a little bit about me. So I'll get into talking a little bit about the program. And as I mentioned, sharing some preliminary data. But before I did that, I just want to acknowledge all the partners on this work. So in addition to the CoMagine Health and CODA and Bridgeway partners, we also partner with a lot of universities to implement this work. Oregon Health and Science University, Oregon State University, New York University. And then we also partnered with the Department of Corrections, because as you'll hear throughout, we went into Coffee Creek Prison, so it was important to have that partnership with them in order to start building relationships with women before they were released from prison. So first, I'll just jump into the project overview. So the ROAR project, as I mentioned, it stands for Reducing Overdose After Release from Incarceration. So I just use the acronym ROAR, but I'll try to repeat that throughout because I know it can be difficult to kind of remember all these different acronyms. So the target population for this project was women who have moderate to severe opioid use disorder as they're leaving prison. So we would start meeting with women about 2 months before they were released to assess their opioid use disorder and their interest in participating in this project. And we would give them a rundown of what the project was. So the intervention had 2 components to it. One was that women had the option to start extended release naltrexone prior to release. And extended release naltrexone is a medication for opioid use disorder. And in this form, women were offered the injectable version, which lasts 28 days. So they would receive it a day or 2 before they were released from prison, noting that this is a time of high rates of overdose, especially for women. So this was, what naltrexone does is it decreases cravings for use, but it also protects someone if they do use, so it protects them from overdose. So that's why this option was available for women if they were interested. And then the other piece was that women were matched with a certified recovery mentor, so either Morgan or Ivy, as they were released. So Morgan and Ivy were able to meet with women at Coffee Creek before COVID. They were actually able to go in and meet with women. During COVID, it was phone calls that they were able to meet up with and just build rapport while women were still at Coffee Creek. And then there was post-release meetups and following through with women for at least 6 months after release. The main project outcomes were overdose prevention and also retention and community treatment for opioid use disorder. So what this looked like, which I already kind of touched on a little bit, is that within 1 week before release, participants would receive their extended release naltrexone injection. As I mentioned, it lasts for about 28 days. And then prior to and after release, they would meet with mentors and as they felt the frequency that they wanted and the needs to address the needs that they had. The treatment was very specific to the needs of each individual person. And as I mentioned, it could last up to 6 months in community, though individuals could stay in treatment or meeting with their mentors for as long as they wanted. Just as part of this project, we just followed people for 6 months. Okay, so that was the brief overview of the project. I didn't want to spend too much time there as we jump into other things, but does anyone have any questions or comments about the project before we get into any of the data?
There hasn't been anything in the chat, just to update.
Okay. Great, thanks, Casey. Oh, and I'm seeing people are saying good afternoon, hello. Hi. Thanks everyone for entering that in the chat. If folks want to do that, that's great to do.
Yeah.
Wonderful. All right, well, I'll keep moving forward, but feel free if things come up to jump in and add in some comments. So I'll just, as I mentioned, share some early findings from the project. So just an overview of what information was collected. We did a baseline interview with women before they were released, meaning just the first time. So baseline just meaning like before they were in the project so that we could assess like what their baseline level was. And then at 3 and 6 months post-release, we also did a survey with people they were doing. And we collected information related
Hey,
to
Corey.
Demographic.
I'm doing well. How are you?
Oh, just remember to mute your phones. I think someone might be unmuted. And so in those surveys, we collected a lot of different information just to see how people were doing. So we collected demographic information, physical and mental health information, whether or not people's experience with overdose was, employment, substance use history, quality of life, pregnancy and birth control, interactions with law enforcement, any treatment services they may have received, and also satisfaction with services. So everyone who participated in ROAR had the option to participate in all of these surveys. But then we also did qualitative interviews with a select group of people. So we randomly selected 1 out of every 3 women to participate in an interview. And the purpose of this was to kind of get a little more in-depth information about what women's experience was participating in ROAR, but also understanding what the transition was like, transitioning from prison to the community, also including what that looks like, transitioning to community substance use disorder treatment. We really wanted to be able to identify the barriers and facilitators to substance use disorder treatment once released from prison, to start identifying ways to alleviate some of those barriers. Also, we wanted to collect some information from women about their beliefs for medication for opioid use disorder. We wanted to understand what their thoughts were on naltrexone after releasing it, but also methadone, buprenorphine, to see what information could be helpful to continue to share with people. Also, we collect some information about experiences and satisfaction with their certified recovery mentor. And that's kind of the piece that I'll share out today related to the qualitative interviews. And then the other thing that we did, we added this on about halfway through as the pandemic hit, but we wanted to see how the pandemic was impacting people, especially thinking about that really vulnerable time when people are being released from Coffee Creek transitioning into community, and then they're having to experience the pandemic on top of everything. So I know Morgan and Ivy will share a little bit more about what that experience was for women in a little bit. The other parts of the data was that every interaction that Morgan and Ivy had with people, they entered in what those interactions were. So we called those our encounter notes. And I'll share a little bit of data about those encounter notes, about how many encounters they had, where those encounters were taking place, and what sort of services were being provided. So I just wanted to give a little bit of background about who the women were who participated in ROAR. So during that baseline interview, the one that was conducted while they were still at Coffee Creek, as I mentioned, we asked a lot of different questions, and we found out that prior to ROAR, most participants had experienced an overdose. It was actually about 2/3 of participants. And the majority also experienced high rates of depression and anxiety. And nearly half of the women who participated had reported a previous suicide attempt. So these were women who had a lot of things happening as they were transitioning out of prison. So the plan today to discuss some of the preliminary findings, as I shared, was we're going to talk about what we've kind of started calling the pre-pandemic cohort, which includes 50 participants. There's 65 participants total that had participated in ROAR to this point, but we're going to focus on the 50 participants because we've noticed there's quite a bit of difference between people that were released before COVID and after. So we really want to look at those groups separately to really understand what's happening for people. So that's kind of why we separated them out here. And then we're going to discuss the impact of certified recovery mentors on retention and treatment. And then I'll share with you some of the qualitative findings, as I mentioned. So here are the number of encounters that certified recovery mentors had with ROAR participants. Again, the 50 released before COVID. And what this graph is showing is that the median number of encounters, meaning kind of the average number of encounters that each woman had, was 15. So that means half of the women had more than 15 encounters and half of the women had less than 15 encounters. And this graph is showing that the number of women is on the kind of the y-axis over here, and the number of encounters they had is on the x-axis. So 12 women had 0 to 5 encounters. And so there's kind of a lot of encounters here that kind of range from 0 to 40. A lot of people had, 8 people had 11 to 15 encounters, and then 1 person had all the way up to 71 to 75 encounters. So there was quite a range of how many encounters people had, and that was really driven by the needs of women and how frequently they wanted to check in with mentors. And then here's a little information about the location of the encounters. So oftentimes, this also might be a reflection of COVID as things had to switch to more virtual and text-based encounters, but it was also used even before COVID that people, just an easy way to check in with people was through text message and phone calls. So the total number of encounters was over 1,000, just over 1,000. Most of those were text messages and then phone calls. And then there were quite a few times where encounters happened at substance use disorder treatment providers, offices, or the treatment space. So that was 141 times. Sometimes there were encounters at the correction or parole office, so 116 times, about 10%. And then there were also some encounters that would happen at healthcare service providers, the participants' residents, public spaces in the community, or some other community agency. So it was quite, there was various locations that mentors were meeting with participants in ROAR. And then the types of recovery the types of encounters that mentors had with participants, there was also a range on this. So there were, the majority were recovery check-ins, checking in on women to see how they're doing and how things are going. So that was definitely the majority of what the encounters were happening. And then there were advocacy efforts that were happening at a high rate. 104 participants or 104 times mentors reported that. And then providing support across a variety of different services. So substance use disorder treatment appointments, providing transportation, helping with resources and needs, recreation. I know Morgan and Ivy will talk a little bit more about recreation in just a bit. And then helping with other appointments. So parole and parole officer appointments, physical health, mental health appointments. So a lot of different services being provided. So I will say, as I mentioned, the analysis is in progress. So we're still looking at things. And the main outcomes were overdose prevention. And fortunately, there haven't been any overdoses of the women who have participated in WAR since the start of the study. So that's just an incredible finding that we're able to see. We haven't been able to compare that to any other data, but that's just something that based on our self-report data and some data that we're getting from DOC that we're seeing. So that's really exciting. The other outcomes that the group is looking at is number of naltrexone injections that people continue to receive. And we're going to continue to explore how the number of mentor encounters impacted participants' treatment engagement. Early findings are showing that there is some relationship between the peers and treatment engagement. And so we're just continuing to explore that, but it's really exciting that we're seeing that. All right, so I'm going to jump into some of the qualitative findings. So these were collected from interviews with women that typically happened around 3 months that they were after they've been released from Coffee Creek. And I'll say, so I'm going to just talk about the findings from related to the mentor questions. And so we would ask women how their experience was going with mentors. And for the most part, everyone responded really positively. And we were seeing positive experiencing happening across 4 categories. People were describing positive experiences related to emotional support, so having someone to listen to them and to share the experience with them. Also, we were seeing what we were calling instrumental support, so it's someone who was there to provide services as they needed. Also informational support, so information, sending along information to provide support for them, giving suggestions, advice. And then there was also appraisal support, so having someone to model behavior and to motivate to see a successful, to see someone be successful in their recovery. So for the most part, participants reported emotional, instrumental, and informational support in the interviews. Emotional support, so that having someone to listen to, someone who cares, was definitely what was noted the most as we saw things come up. But there was also information related to housing, employment, food that was really frequently brought up. And so that was really interesting to see in the data. There was also relationship development and maintenance were core themes that we saw. So it was like ideas around like reliability and trust, that if they needed anything, that there was someone there. And this kind of related to something else that we were seeing, that even people that didn't utilize the peer delivered services very much, they knew that it was there if they needed it. So it was like, it was just helpful for them to know that the mentors were there. And so that was something that was really interesting to see. Okay, so I'll share this quote that I pulled in for about the positive experience. So when I first met with my mentor, she just gave me the rundown on herself and what we were going to do and when I got out. It helped because you are getting ready to leave prison. You catastrophize what's going to happen when you get out, because your whole life for the past however long you were in there has been set up for you, planned day for day or hour for hour. Having that unknown, it's really stressful, and it makes it to where you almost don't even want to leave. Having her give me the reassurance that this is how things were going to go and it's going to work out well helped a lot. So the transition time was really helpful for an opportunity to meet with the mentors. Okay. I did want to share that there were some individuals who shared some challenges to working with the mentors. And this again is, self-reported their perspective on the interactions with the mentors, and could be related to different needs that women had or different approaches to the services that they had. So some of the other experiences that were noted were that the CRM was not providing enough needed support, or the expectations around what support the mentors could provide wasn't clear. Some participants reported that they felt the mentor was too busy. And then a component that the participants shared quite a bit is that having a mentor at this time of transition was really overwhelming, having a lot of appointments to pay attention to, having lack of time or technology challenge to engage with mentors was something that was challenging. Now, I shared a couple quotes here, so I'll read those off. I don't communicate with her very often because she's got other people who need her and her time more than I do. We check in every now and then and how are you, but I don't occupy very much of her time because I don't need to. And then another participant said, it was too much for me to manage all the relationships. It was too overwhelming. I felt a pull and resistance trying to accommodate schedules with both and or finding time on their schedule when you could help me because they're very busy also. It was really inconvenient. I feel for all parties. So just a couple of challenges that were mentioned. And then we also asked participants if they would share recommendations for what would help working with mentors go better, and also things to note that their mentors were doing that they suggested they should keep doing because it was really helpful for them. And what the first thing listed here was attending group meetings together. So being able to go to those meetings was something new and trusted, was something that people reported being very helpful for them. Spending more time together to work through complex issues, and also providing more wraparound support that includes substance use disorder support as well as mental health support. So many of the women mentioned having a lot of things happening in their life related to housing, transportation, their families, their kids. So being able to provide support, not just related to their substance use disorder, but also related to these other things happening in their life was really helpful for them. All right, I will pause there. There's a lot of information. I'm excited to hear what people think, or if you all have any questions.
There was one question in the chat that maybe we can use to start off. It was over what time frame for the encounters?
Yes, that's a great question. So the time frame is over 6 months.
Someone also just asked in the chat, how are you meeting with peers in community? I'm assuming, Lindsay, if you want to jump in, I'm assuming it's saying, how are you meeting with peers in the community? And then a question about funding.
Hey, yeah, thanks. I appreciate this workshop and the information you're presenting first off. And so one of the things I would like to know is how you are, I guess, safely meeting with peers in the community, and how you're doing some of that work while they're still within the facility to the time that they're getting out. And then are the peer mentors being paid? And if so, how? Thank you.
Oh yeah, thank you for that question. That's great. I can answer the question about funding and payment. So this is a funded research project that has funding from the CDC, the Center for Disease Control and Prevention. So that's how everyone on the project that works on it, including the mentors, are being paid. And then Ivy and Morgan, I'll let you answer the question about meeting with women in community.
Hi, but we aren't able to transport now like we used to, which is a huge part of what we were doing. But in the community, it's limited, but we just practice social distancing and wear a mask and meet somewhere in public for coffee or whatever. That's been the majority of it since the pandemic.
How are you guys meeting when you're in the facility, or how are you connecting your peers that are in the community with the peers that are in the facility?
Since the pandemic started, everything's been over phone when they're still incarcerated.
We did get to go into the prison before March of last year, but
Right.
then that stopped and never returned again. And because it was run by so many different companies, like you really had to follow, you know, OHSU's guidelines and what they were practicing. Like even if we were allowed to at our own company, like meet safely in the community, that wasn't always recommended. So.
Oh, and Lindsay, I see your other question. Do people in the facility self-refer? So what was happening is that we had a partner who was a a qualified mental health professional that was a staff of the Department of Corrections. So they worked in Coffee Creek and identified people that had close release dates that could participate in the program. And then they described the program to them, invited them to participate. And so if they were interested in participating, then I would go into Coffee Creek as the researcher and explain the project a little more and then connect them with Morgan and Ivy. What we saw started happening was that people that started hearing about the project then would go up to the QMHP and ask to be in the project. So that was really exciting to happen as the program kind of got legs and people started hearing about it. People were interested.
There's another comment and another question in the chat. If you'd like me to read those. Or if the people who commented them would like to jump in as well to say them. But Willie said, peer support has many vast agendas. This platform has provided me with information that I have never encountered before. It's great to see that we are a valuable component of the services offered to our client base.
Yes, thank you for sharing that, Willie. That's exciting.
And then Lindsay also asked, how are you getting your peers in the community and training them?
Oh, sure. Yeah, Ivy and Morgan, maybe you can talk a little bit about the training that you experienced.
Well, we were both already peer mentors, so we had that part of the training, you know, pretty well down. There was a lot of intense training around research projects because you have to be part of an IRB, the Institutional Review Board, and there was like a good 2 weeks of learning about research, learning about corrections populations that you had to go through and then be approved before you could actually be on the ROAR project.
I also got another question. Ivy and Morgan, will ROAR help in regards to lifestyle the individual will go home to? I know for a lot of women, or this person sharing is saying, I know for a lot of women, the drugs are to self-medicate and two things can come up once they release. They have the trauma from the prison itself, and secondary, their home life may not be safe or healthy. As peers, we can't fix, just wondering if this is an approach of the research and in the works for research.
I think a lot of this will be answered as we do our presentation also, some of these questions.
Oh, Erin, you're muted, I think.
Thank you for that. Sorry about that. Kendra said, how can we get this going in all counties for all substance use and addiction? So as I mentioned at the beginning, this is a pilot project. So the hope with calling it a pilot project was always that it would be expanded to all counties, because right now it is just Marion County and then the Tri-County Portland metro area. So Multnomah, Washington, and Clackamas. The hope was to not only offer naltrexone, but also offer other medications for opioid use disorder like methadone, or not methadone, because that can't be offered, but buprenorphine, Suboxone, and have this peer option for people as well. COVID did delay some of the hopes for Department of Corrections to make that a reality, but they are still trying to work on a protocol after seeing some of the early successes of ROAR. So really hopeful, but not totally sure what that's going to look like yet. Okay, I see another question. I'm sorry, I'm not fully, oh, Christina, I can see names now. Are you still in Coffee Creek and have your peers serve time as well? We're not still doing recruitment for the project. That ended a couple months ago, but hoping to have another project hopefully soon, but currently not doing projects. And Ivy and Morgan, do you want to share about your experience with incarceration?
I have, but yes, I have been incarcerated myself to answer that question.
Yes, I have as well. I was released from Coffee Creek in 2006, May 18th. So it's my anniversary is coming up.
That was identified really early on as an important piece, not only lived experience of substance use disorder, but also experience with incarceration, since it can be, you know, it's a difficult transition for people, and having that experience could be really important. See, Sean said, hi from P-Town. Any thoughts of serving other institutions, county, other behavioral health institutes? I don't know. I think that'd be awesome, but I don't know what plans are. I know the lead of our current project is doing some work in Washington County Jail. I think the hope is to offer some services in jails. And so I know some other groups do some work in other jails around the state. I think it would be really neat to see that expanded to other behavioral health institutes as well. Oh, Catherine asked a really nice question. So were you able to offer naltrexone to women with alcoholism as their primary drug of choice? The women needed to have an opioid use disorder that was moderate to severe in order to participate in Aurora, but many women did identify as having alcohol use disorder as well, and shared anecdotally that they felt the naltrexone was helpful for that. Naltrexone, there's been a lot of clinical trials done that it is helpful for cravings with alcohol. I, as women found out that naltrexone was offered, more women with alcohol use disorder did start to want to get into the project because of that. That's all anecdotal. We heard from our partners at Department of Corrections, but that's definitely an important component of the naltrexone. Okay. Oh, I see one more question. Has the admin at Coffee Creek expressed interest in funding this service beyond the end of this project or this pilot? Yes, the plan is for them to fund some sort of project that will be separate from research that they'll implement on their. So hopeful to see that come out soon. As I mentioned, COVID kind of slowed things down, but I'm hearing from them that they're still working on a protocol to make sure implementation happens. Oh, Catherine, thanks for sharing that. Catherine shared, I'm an alcoholic, naltrexone saved my life. And then I also see Emily shared as well. I was personally on naltrexone for 1.5 years at the beginning of my recovery, and it helped so much. Thank you both so much for sharing that. All right. I don't see any other questions or comments, but please feel free to keep sharing them. It's so great to hear from you all, hear your experiences and your great questions. We built in a little break time, recognizing that an hour and a half is kind of a long time for everyone to sit here. So before we get into the next part, just thought people could stretch and take any break time that you needed, and we'll maybe take 5 minutes and come back at 1:40-ish, and we'll continue on with the presentation. Thanks, everyone. Right. I see Morgan Ivy, you're both back. I saw one more comment came in from Willie that said, exciting, yes, but it's great to see and hear how much data has been collected on the results of our work. So great. Yeah, it's exciting to see some of the data. Thank you for sharing that. All right. Morgan and Ivy, are you ready for the second part? Okay. So we sort of set this up interview style for discussion with our war mentors about their experience. And so let's see here. So for the second part, I'm going to kind of interview Morgan and Ivy. Please feel free to continue to add comments and questions in the chat box. We plan to have plenty of time at the end to continue this discussion. So for the first question, I'll ask you first, Morgan. Will you tell everyone a bit about yourself and how you became a peer mentor?
Sorry, I was trying to unmute it. Yes, I became a mentor because of my own recovery that started when I was sentenced to prison for 5 years. Prison saved my life. That's why I have a passion for working with women in the correction system. After I was out a few years, I decided to go back to school to become a drug and alcohol counselor. I got my CADC and started working as a mentor at Bridgeway. Shortly after that, I realized I didn't want to become a drug and alcohol counselor. I love being a mentor. However, I keep my CADC, so I'm able to do things like groups and assessments and things like that.
Great, thanks, Morgan. And Ivy, how about you? Can you tell us a little bit about yourself and how you became a peer mentor?
Sure. I became a peer mentor totally by accident. I was released from Coffee Creek in 2006. I decided to go back to school in 2011. I met with a career counselor at PCC, hoping to get into something like dental hygiene or ultrasound technology. But he told me that with my 5 felonies and one being a Class A, that the drug and alcohol field was really my only option, which isn't true. But I entered the A&D program at PCC. I completed a practicum as a counselor at CODA's Women's Residential in Gresham. I tried to find a job as a counselor there full-time, but there was no full-time positions open. So I applied for a mentor position, and I'm so glad that I did because like Morgan, I realized that I didn't want to be a counselor. I really love the freedom of being a mentor. It's easy to schedule around your life and be a mom and go on field trips with your kids. And I love being able to share my experience, strength, and hope with others.
Great, thanks, Ivy. Morgan, so can you share about how working on the ROAR project is different from the work that you already do and still do at Bridgeway?
Yeah, before ROAR, I worked with women from Coffee Creek, but I didn't have contact with them until after they were out. With ROAR, we get to build relationships with the women prior to them releasing, which is helpful. Because that way we have an idea of their needs once released and can help them better. They also feel more comfortable with me because we already have a relationship, so it's easier for them to reach out. When I first started working at Bridgeway as a mentor, Tina, who was my supervisor at the time, and I were talking about how cool it'd be to go into Coffee Creek and build a relationship with the women prior to them releasing. And now I've been able to do that with ROAR, so it's been cool.
Great. And Ivy, how about you? How are things different on ROAR than your other work at CODA?
A lot of it is the same. I was working with women getting out of the Washington County Jail. I was going in the jail, coordinating pre-release plans, helping them get set up to be successful post-release. The biggest difference is ROAR is a research project, and that can be very different from like straight clinical work, where you might, just because you would typically do something like trying to re-engage a patient after a certain amount of time, if that's not part of the ROAR protocol, you can't do it. So that was odd for me at first and felt a little weird. But once I understood that this research project and research projects like this are how these programs become standard practice at places like Coffee Creek, that helped, knowing that we were part of that. And because getting the Vivitrol injection before you release is super important, and it's not offered right now and you can't really get it after you release because a lot of times if you use, then you have to wait 10 days in order to get it. So that can make it difficult. You have to get lab work, which they were able to do inside Coffee Creek. So that was nice. So being part of that was pretty cool.
Hey, thank you. And Morgan, what kind of ways have ROAR participants asked for your help or support? Or what are some of the questions that you get from participants most frequently?
Everyone's needs are different. The first few visits, when I go into Coffee Creek to meet the women, I'm able to get an idea of what their biggest barriers are going to be and what kinds of things to focus on when they get out. It could be clothing, getting a job. Everyone is different. For a lot of women, it's just support around the adjustment of being out. For some, it's easy and no big deal, and others, it's harder. Some women engage easier than others, for sure. There are times it feels like we have to work harder, or we do work harder than them at first to get them engaged, and that's okay.
And can you talk a little bit more about the challenges of getting out of prison for some of
Sure.
these women?
Yeah, it's hard because it's like the world has gone on without you, and everything has changed. Your family and children have gotten older. It's hard to figure out where you belong in all of it.
And anything to add to that, Ivy, about the challenges?
Yeah, getting out during COVID was something none of us had ever experienced before. So that was different for them pre-release. They were following all these COVID guidelines inside the prison. It was also different post-release. They were literally released in the middle of a global pandemic. And like Morgan said, the world was going on without them. They only heard about what was happening. And then they were released and they were supposed to jump back into that life and being told they need to isolate as well as try and reintegrate with society. So that was definitely different and a challenge.
Yeah. So for people attending, Morgan, probably over a year ago, did an interview with the Oregon Public Broadcasting Think Out Loud for their Prison Pipeline series. So if folks haven't heard that, I could maybe share the link in the chat so people can see. But Morgan, during that interview, you mentioned that when you were released, you felt like an alien. Can you tell us a little bit more about that feeling?
Yeah, getting out of prison, I didn't realize how hard it was going to be. When I first got out, I remember my mom and aunt took me to get food, and I was just looking at the menu and was overwhelmed and I couldn't order. There were so many choices, and for the last 5 years, the choices have been very minimal. So I couldn't do it, and they did it. They had to do it for me. I had a hard time going in stores by myself. I felt like I didn't belong there. I didn't know how to interact with people. I felt like I had a sign hanging above my head that said I just got out of prison. It just felt awkward for like the first month everywhere.
Thanks for sharing that. And Ivy, anything else to share about what has been unique about working on ROAR?
It was unique that ROAR was a research pilot project funded by the CDC. You already said that. But that was unique for me. And as part of that, we were involved in peer-reviewed articles that were published in journals. That was pretty cool. We had a lot of training to start out with, the 2 weeks of intensive training on research and corrections, had to be approved by the IRB. And also with ROAR, because it's a research project, you can only discuss a patient's participation with other people who are approved by the IRB. So most of my coworkers were not. So you're not allowed to reveal their status as a participant in the project. And also you had to call them participants and not like patients or clients. So that was unique about ROAR.
Yeah, those are great examples. All right, so let's jump into success stories. Ivy, do you want to share a couple success stories of women that you worked with?
Sure. I had one woman who was getting her Vivitrol. She missed her injection and she relapsed on heroin, and she had to have 10 days abstinent before she could get her next injection, which with opiate use disorder, that can be very difficult. But she was able to successfully do it. She received her next injection. She really wanted to frame it as like, I messed up, I let everyone down. But in the end, she was able to reframe it as that she was actually really strong, because being able to do that is very difficult.
Oh, absolutely. And Morgan, how about you? Any success stories to share?
Yeah. Our first participant who I worked with was getting out of medium. She had a tough relationship with her oldest daughter, who was living with her oldest sister, adopted her. The daughter didn't want anything to do with the mom. Before she got out of prison, the participant worked with the sister and got her into a camp for kids whose parents are incarcerated or been incarcerated. The lady I was working with had to come to terms with she may never have the relationship she wants with her daughter, and she just had to accept it and come to terms with it. The participant ended up seeing her daughter her second day out. It went really well. They have been working on their relationship, and now her daughter stays with her 4 nights a week. This happened quickly also. The participant completed the study. She found a job. She stayed on Vivitrol for over a year until her and her partner decided to have another baby together. And we're still connected, and yeah, she's doing amazing.
That's incredible. Such a great story. Ivy, any other stories to share?
Yeah, I had one woman who I was working with who had several setbacks, used not opiates, and which could have easily led her back into active addiction. But she never gave up. She took accountability for her mistakes. She reevaluated what wasn't working. She got back up, kept moving forward. She always got her Vivitrol injections every month, no matter what. And she didn't use it as a reason to like stay stuck, which is important to do in recovery, because often our addict brain can tell us that it's hopeless and that we should give up. And that is a very hard voice to combat. So I thought that was a good success.
Yeah, that's really nice. And Morgan, how about you? Any other stories to share?
Yeah, so there's another woman who was released like right before the pandemic hit, like before the shutdown, I should say. And she's never been in recovery before. She's been in active use her whole adult life. She never had her driver's license, yet she always drove. She got released from prison, decided to start school to become a drug and alcohol counselor. She figured if she made it through, like, she would have an awesome story to tell. And she will. She was nervous about school because she struggled in the past. However, she's gotten straight A's and got on the honor roll every term so far. She could have graduated treatment at Bridgeway before she did. But since COVID, she wasn't able to establish a clean sober support system outside her family in Bridgeway at the time. So she wasn't ready to complete services. She said she still benefited from the extra supports. She did really well. Now she's got her driver's license for the first time in her life. She bought herself a car. She ended an unhealthy relationship. That was one of the last things to go, but she did do it. And she just continues to do the next right thing.
Very cool. Thank you for sharing.
Yeah.
And Morgan, what differences, well, talking about COVID, I know you just brought that up. So what differences, if any, have you noticed about women's experience after release, once they were released during kind of shutdown times compared to pre-shutdown times?
It has been difficult for women during the pandemic. Availability for housing has been especially hard. For example, there was one woman who was getting ready to release, had everything set up for her, and didn't find out until the day before that she couldn't go to the Shelley house. The Shelley house went on quarantine and wasn't allowing anyone new in it. It was just roadblock after roadblock for her. Nothing went as planned, but another woman had everything on track to get her hair license while she was in Coffee Creek, but she got out early and wasn't able to schedule, now hasn't been able to schedule it until this month. That makes it really difficult for her to find employment because she was planning on having that and going right to work. Women have also experienced many barriers during this time. They have been unable to get their driver's license or ID because DMV appointments are booked so far out. And you can't get a job without an ID. Also, the accountability of supervised UAs, POs aren't doing them as often, and many treatment providers aren't doing them at all. We actually just started doing video oral swabs. We have a system, but that's recent. Many women need structure and accountability and the guidance to avoid getting drawn back into the old habits that impacted their life negatively. And they just haven't had the support of the accountability to stay on track. Another piece is just the uncertainty of everything right now. Everything's always changing and nobody seems to know the right answer for them.
Right. Yeah. Those are really important pieces. And Ivy, I wonder if you could talk about some of the changes that you've made to your approach during the pandemic.
Building strong relationships became like my main focus because that's kind of all you really had. You couldn't take them to do things like you used to. And being able to build that strong relationship without being able to like assist them and transport them and help them on their first days out was challenging. So instead of transporting them to different appointments, I sent lots of links to different resources to apply for SNAP benefits, virtual NA and AA meetings, job applications, temp agencies, and just, whole websites full of COVID related resources and funding for different things. And luckily, lots of agencies were doing a lot of things online and virtual, so that was helpful for them. And also helping them navigate the technology because, depending on how long they'd been there, they hadn't been on technology. And I think we can all, we've all had our difficulties with navigating technology, even if you're really good at it. We also got pretty creative. We were able to drop food boxes off of people's front doors with hygiene items, clothes, phones. One time I sent some care packages with mindfulness activities and arts and crafts and gardening supplies and candy. That was really fun to do, and they seemed to really like it. I will say that in the beginning, when we first were told we couldn't transport, I was like, and I kept having to tell people that, sorry, no, we're not transporting. I was like, what's the point of having a mentor? If you can't do anything besides talk to them on the phone or text them. But I did realize a couple months in that we were really helping them. We were helping them learn to navigate all those things, or helping them, research the latest guidelines because things changed all the time. And we were there to help them get re-engaged when they fell through the cracks. And, if they didn't have a mentor, sometimes they might not have, they might have just been off and running. So those are sort of the things I did.
That's great. Yeah, you all were so flexible and creative about your approaches over the past year. Morgan, I'll ask you this first. So if you could change one thing about your work or working with women or addiction treatment in general, what would it be?
I was fortunate when I was released I had a support system. I have a loving family. I don't know what I would have done without them. Some women get out and they don't have anyone clean and sober in their life. I wish all women had a support system when they got out and clean and sober living. I also wish it was easier for women to get their driver's license back, or people just in general getting released from prison. It's a challenge because every city has different guidelines and on releasing holds on license. Not having a license is a huge barrier to making it to appointments, job interviews, treatment, parole and probation, and if they have to rely on the bus system.
Ivy, what do you think? If you had a magic wand to change things, what would you do? Oh, Ivy, you're on mute still.
trying to remember every time. I definitely agree with Morgan. Having a supportive family is one of the main things that help me stay clean. So if I could give that to everyone, I would. And being at Coffee Creek, you see so many women that don't release to supportive families or anybody, and all their role models have been people using, and that's what they return to, or they return to nobody because they don't engage with that because it's risky. And that's just such a challenge for them. So knowing how important a new support system is, I really tried to help them build that and be that for them until they did build that.
Great. Okay, so this is the final question for both of you. So what are the most important parts of your recovery that you share with others?
Oh, me or Ivy first?
Either one. Morgan, you can
Okay.
go first.
Prison and running saved my life. It is so important to have something you enjoy to keep you busy when in recovery. When I was first incarcerated, I was 23 years old. I gained 50 pounds. So I started running. When I first started, I couldn't even run a lap. I can remember the first time I ran a mile. By the end of my sentence, I was running almost 10 miles daily. I'm grateful I started running in prison, because if I wasn't in prison, I'm sure I wouldn't have stuck with it. I would have given up and gotten frustrated because I haven't gotten quick enough results. Weight gain has always been a trigger for me. I'm grateful I was able to get that niche while incarcerated, and I was there long enough to make it a part of my everyday life. Running helps me regulate my emotions. I was young when I started using, so I had minimal coping skills. Running worked for me, and I held on to it with dear life. I still do it every morning, maybe at least 6 days a week. Physical fitness has been such a huge part of my recovery. I know it can work, so I try to push it on the other women, especially women that already started doing it in prison also. One thing I started at Bridgeway is an exercise group. I've done it there for the last 7 years, and try to help encourage women to get active, stay active, and yeah.
There are so many different things to a successful recovery. I always say pretty much changing everything about your entire life. It's just that easy. No, just kidding. I think, but a sober support system is super important. Exercising is amazing for your mental health, and really just learning to take care of your whole body, your whole self, as mind, body, and spirit.
Well, thank you both so much for sharing. All right. That's the last thing that we had to share out. Oh yeah, and so just opening up the floor for any question, comments, or thoughts on anything we shared today. I'd love to.
There were a couple of questions in the chat to get us started. Lindsay asked, what is the process for mentors, or what is the process mentors get to come into support? Is there a waiting period before a mentor can come back and provide mentorship? Lindsay, do you want to expand on that at all?
Yeah, thanks. I'm just curious if there's any, if people are leaving the facility to time they can come back to support other women, if there's any time restrictions on any of that.
I don't know. Mine's been, I got out in 2007, so it's been well over 10 years, but I feel like it's 5, but I'm not I'm not positive on that.
Yes, I definitely think there is some sort of time limit, but I don't remember either.
Okay.
Kendra writes on here, she actually might have the answer to that.
Oh, thanks, Brittany. Yeah, it is 5 years actually, but there are some approvals that they will approve. So say you're going to speak on behalf of Celebrate Recovery or some sort of program that's in there, you can get an approval if it's been under 5 years. I've gone back a couple times, so. And I guess I'll have like another comment that I was writing in the chat box as I was called out by Brittany. No, I don't mind. Another something, I don't know if your program or pilot program addresses this issue, but something that I'm still, I mean, I've been out almost 7 years now, and I'm still paying on my restitution and fines, which was a mandation in order to get my license back, was to pay on all this restitution that I had. So I did like a chunk of time, and then I come out and I still am paying for my crimes. And then some other barriers are like housing and things like that, you know, which is already a crisis for people who don't have, you know, criminal barriers. And then you get out and people don't want to rent to you because you have a criminal background. So, but, you know, as a community, we don't really talk about that. In these rooms we do, but not, you know, as the whole community. So.
Gosh, yes, absolutely. Those are such important things to note. Oh, Morgan, I see you unmuted if you want to add.
And it doesn't matter like how many years it's been for you too, if you have that felony on your record for housing and stuff. I've seen like many counselors and people I work with that have had many years clean, and it can be hard.
And also, like, you know, that can keep people in abusive relationships, because if your partner, you know, once you get out, you can't rent an apartment, but your boyfriend or girlfriend can. Even if it's a bad situation, you can't get a place on your own. So people often stick it out. So I think being able to have housing when you get out is something that I hope will move in a different direction.
The housing piece became especially prominent during COVID. Ivy, I wonder if you could share what was happening with women about that like isolation period that was required for a little bit. That just was terrible.
Right, and it changed all the time, because like Coffee Creek was on different tiers, and if they were on tier 4, then depending on what county they were releasing to, the different counties had different you know, guidelines. I had one woman, she released from like tier 4 was how many cases they had, and until they were back down to tier 1, and it went up and down the whole time. So she released, and she had to go to a motel in Hillsborough for 2 weeks. She didn't have a lot of friends and family. She really didn't have anybody. She'd been in prison for a while, and she had to stay there by herself for 2 weeks. You know, she watched as much TV as she could. And, you know, I got her a phone through a different program, and, you know, brought her some arts and crafts and, you know, paint and gel pens. But there was only so much of that she could do. And she really had a hard time at the end of it, and said that was one of the worst experiences of her life, was spending that 2 weeks alone in a motel room, pretty much alone. We talked on the phone occasionally, but, you know, we had never actually met each other in real life. You know, we talked a few times, and then I had another girl that was getting out, and Coffee Creek was back on tier 4, but she was releasing to Washington County. So I talked to somebody at DOC. I talked to her probation officer. I, you know, tried to coordinate everybody. I talked to the housing. I was like, is she going to be released to housing, or is she going to be released to the motel? Because I wanted to get her prepared if she was going to have to sit in a motel for 2 weeks by herself. And, you know, so it wasn't like a shock or a surprise. And from what I could tell, she was going to have to go to the motel because the housing lady didn't know anything about it. Her PO was like, I put in a request for a respite shelter. I thought that was the COVID motel. And DOC didn't know one way or the other whether she was forced to isolate for 2 weeks because it was a different county anyways. And then so I got her prepared for that, canceled one of her appointments, and then turned around. She went straight into housing, and, you know, so it it was very difficult with things changing all the time and often people not knowing the answers when you asked, like, what's going to happen? I don't know.
There was a comment from someone in regards to that said, I work on the men's side of this and the COVID motel rooms mess things up so much. It's from John. And then there was another question from Brittany, which is, how can you get involved doing this?
Yeah, Ivy, maybe you could go ahead and share how you got involved.
Well, with the research project, that's kind of come to an end, right? The last people we consented were, I think the last release was January. So we are not consenting any more people, and then we're following the last person from January for 6 months. And then that's the end of ROAR, that part of it, but hopefully it will become standard practice.
Yeah, I'll say from the research side of things, we typically partner with treatment agencies, harm reduction agencies that already hire peers and have peers, and we partner on different projects, things that a lot of times are already doing, but we collect data on to show and highlight the great work that's being done. So that's kind of how it looks like, how we end up partnering with different levels of peers.
I have a question to that. Have you ever connected with sponsors here in Lane County? I volunteer as a mentor, and so it's not necessarily peer support, but they have peer supports within, you know, their systems, because they house men and women who are releasing, and so they try to get mentors connected. So I wonder if there's a way that you could maybe partner with them and offer some services here in Lane County, because I really see a value for that. I've mentored several women who have released in the past year. And I would love to be able to do more within the facility, or like contacting them more. And I just foresee it like really expanding here in Lane County. I think there's a big need for it for sure.
Yeah, thank you for that suggestion. I have it written down and I'll share with our team. I really appreciate that.
There was another question from Lindsay that said, how do you hope to make it standard practice? Could you please give some examples that have already been taken or next steps on your end?
So for how we hope it becomes, I guess I shouldn't speak for our entire team. I can speak for like how I'm thinking. I hope it becomes standard practice that women who are released have the option, regardless of their substance use disorder history, because we all know the mission, as we shared, is difficult for everyone, that people can have access to a peer recovery support specialist as they navigate that transition, especially people with substance use disorders, especially people with mental health disorders. The logistics of the systems are so complicated. It's just helpful to talk with someone who has experienced it and have someone be there for you. And I think that piece that Morgan had talked about, that before war, she was meeting with women after they were released, but that piece about meeting people before this, I just think just crucial to work being really. Would hope that that could continue to happen, that corrections could implement that and continue in the men's facilities as well, having the option for peers to meet with people who are released. The other component, the side of this project, which is the medication for opioid use disorder, I wish the option for women to continue on medication as they enter prison, they choose to do so, and as they're released, has the option of getting on something if they choose to, would be something that the Department of Corrections would implement more broadly. I know they are starting to in little ways, but that would be how I would think it would be really important to see. How it's examples of how it's already happened is that the Department of Correction is drafting a protocol for implementing this not this program, but expand program to address the high rates of overdose that are happening as people are releasing. So they are in the works of moving that forward. Unfortunately, I don't have a timeline on that or anything, so hard to say where it is right now, though.
Right, and just to add to that, Erin, like I worked with women at the Washington County Jail in Hillsborough, and you know, if they were in there for 2 weeks and had 2 weeks clean of off of opiates, like it's perfect time to get them on Vivitrol, but you can't. You have to get them out, get them an appointment. They have to get lab work. They have to wait a week for the lab work to come back, and then they can get their Vivitrol. And for anybody that's ever released from a county jail, they often do it at 4:30 in the morning. So your support system is your old drug dealer, and that's who you call. And no matter how much you want to stay clean, like, and you might have every intention of not using when you get out, but there's something about when your feet hit the pavement, like your belly does a flip flop, and you know, it's 4:30 in the morning. So having women or having everybody be able to get the Vivitrol injection, or I think in Washington County, they're trying the Sublocade, the 28-day Suboxone. You know, getting people on medication before they leave would just be amazing.
There are a couple of comments I'll read. Joanna said, sometimes if you have a great grant writer, they can write a grant to fund for peers of the agency. And then Willie had a comment that said, gee, such incredible stories, ladies. Even though things are pretty much stacked against all of you, you have shown powerful resiliency. And because of that, you have changed and helped many other inmates or just clients that visit your office.
Thank you.
Thank you. Yeah.
Great. I know we still have a little more time, so we'll stay on. If any other questions or comments, people feel free to unmute yourself too if you prefer to say it out loud other than the chat. I'm also going to share this last slide just so that you have our contact information. If you have any questions after or want to follow up on anything that we shared here today, feel free to reach out to any of us. I think we're excited to talk about this work.
Well, I'd like to mention, participants, make sure you save your chat. That's all.
Yes, thank you for that. All right. I'm not seeing anything else. Well, thank you all for all the kind comments, and thank you so much for the great questions and being a part of this. It's so nice to be able to share this information with people and get such great questions and learn from all of you. So I just really appreciate it. Casey, is there anything else to close things down, or should we just?
No, just a reminder that if you did want to come back, this workshop will be recorded, or it is being recorded and will be uploaded to our YouTube and website. As Willie mentioned, the option to save the chat is down by file, 3 little dots. You can save the chat there. So yeah, thanks everyone. But that's all I have. So I'll let you all close it out if you have anything else.
I think that's all we have. Thank you so much for everyone joining. Morgan and Ivy, any last things to share?
No, just thank you.
I have one last bit of hope for people. When you're released and all those things are stacked against you and you can't pass a background check, I'll say that I have 5 felonies. I have a Class A felony, and I've been able to pass background checks. Well, I've been able to appeal background checks and volunteer in my daughter's schools, and I appealed one for the Girl Scouts too. So I am a member of the Girl Scouts, even with 5 felonies and a Class A felony. So it does get better. It takes lots of years though.
All right, I'll go ahead and end the meeting. If anyone has any last things. Thanks, everyone.